Good evening, everyone, and welcome. I'm Dr. Karen Bender from Whole Health Wellness Center, and thank you for joining me this evening for the webinar SIBO Explained, Why Not to Ignore Bloating and Gas. So thank you, everyone, for joining me tonight. I'm going to go ahead and jump right in. Feel free to ask any questions in the chat as they come up, and I'll do my best to answer them as we go along. So just briefly, what we're planning to discuss in this webinar tonight is just understanding what is SIBO. I'm sure many of you maybe have some idea what it is, but maybe some of you do not. So I will go into that, as well as talk about the causes of SIBO and how it can affect our overall health, and then treatment and of course also prevention of SIBO. And then you'll be given an opportunity to book a free discovery call at the end of the presentation. All right, so first off, what is SIBO? It stands for small intestinal bacteria overgrowth. So bacteria, or what we call the microbiome, exists in our bodies throughout many parts of our bodies, on our skin, in the nasal passages, but primarily where we think of it is in the gut, or when more recently people talk about it, they're talking about it in the gut. But more specifically, the bacteria, the good bacteria that comprise the microbiome, should be in the large intestine or the colon, not in the small intestine. There may be a small amount of bacteria that get into the small intestine, but primarily it's all in the colon. So small intestinal bacteria overgrowth is not a healthy place to be. It's when the bacteria in the colon have migrated their way up and are now in the small intestine, where they can cause some problems. So I'll get into the symptoms and the treatment of this as we go along. So now that you know what SIBO is, you might be wondering, how do I know if I might have it, or what are the symptoms? The most common symptom is gas and bloating, and that I would say is the most characteristic of it. What causes that is the bacteria get the food that you've eaten that isn't fully absorbed and digested yet, and starts to actually digest it itself and ferment some of those foods, the carbohydrates, etc. And that can create a methane or hydrogen gas that expands and causes bloating. A lot of times people describe the bloating as so severe that they feel like it's as though they feel like they're pregnant, or the distension in their abdomen is visible and they can see it. It can be quite uncomfortable. But there are some other symptoms that can go with SIBO that might not be as obvious to correlate it with bacteria being where it shouldn't be. And that can be constipation, not having a bowel movement every day, diarrhea, even loose stools. Heartburn can be associated with SIBO, changes in appetite, abdominal pain, nausea, that feeling of fullness, because oftentimes the bloating occurs shortly after eating. It can also lead to weight loss, partly due to malnutrition, and can contribute to anxiety and depression. So all of these symptoms can be related to SIBO, either directly or indirectly. So now I'm going to go into a little bit more detail of what causes these bacteria to get into the small intestine and what we can do about it. So if you think about the digestive tract, the stomach is full, or should have a good amount of acid. And one of the roles of that acid is actually to kill bacteria that come from your mouth. So if you don't have adequate stomach acid, some of those bacteria can get passed on into your small intestine, where they can then grow and overgrow, as it is with small intestinal bacteria. There's also some mechanisms of your digestive tract that help keep that number of bacteria in your small intestine down. And it's the migrating motor complex, sometimes called the MMC, which is what causes the impulses of movement of your small intestine, moving that food down. It's called peristalsis. And it's very important for the progression of your food through the digestive tract. And it also pushes those bacteria along and keeps them from overgrowing as well. The other thing is bile from the gallbladder. Bile is mostly known for its importance in emulsifying or breaking down fat, but it also can help to kill those bacteria and keep them in check. And then also the digestive tract is a primary site, of the immune system. And there are immunoglobulins in the small intestine that help to bind bacteria and other pathogens that come through it. And if there's just not enough of these immunoglobulin, you might be more likely to have overgrowth as well. The other one is actually a valve between the small intestines and the large intestine that kind of help keep them separated. So if there's any dysfunction there, some of the bacteria from the large intestine can get backed up into the small intestine where they can replicate and reproduce and cause an overgrowth there. So if you have any problem with any of these things, if you have low stomach acid, either from being on a acid reducing medication like a PPI, Nexium, these kind of medications that lower your stomach acid, you're at increased risk of developing overgrowth in your small intestines. All right, so just a little bit more about stomach acid. Like I mentioned, it can be caused by the use of antacids, but also things like stress. Because there's the simple way of understanding it is that your digestive tract is divided, or your nervous system is divided into the parasympathetic and the sympathetic nervous system. So when you're under stress, it is stimulating the sympathetic nervous system, and the parasympathetic nervous system is not as stimulated. And it's very important for the parasympathetic part of your nervous system to do things that helps improve and support digestion, such as secretion of bile and stomach acid, as well as enzymes from the pancreas. So if you have any of these things, stress going on chronically or when you're eating, that can reduce your stomach acid as well. Also, certain foods that can cause that are inflammatory can affect the stomach. Nutritional deficiencies and even infections of H. pylori can lower stomach acid. And then here you have this kind of interesting idea. A lot of people think that they take antacids because they have too much acid in their stomach, but actually when you have low stomach acid, it relaxes the valve between the esophagus and the stomach, allowing that acid that should be in your stomach to go into your esophagus where it's not supposed to be. The tissue of your esophagus is not designed to handle acid, so you experience a burning sensation. So of course, it's very uncomfortable, so you're prescribed an anti-acid medication, which then might make you more likely to have other pathogens into your stomach, such as H. pylori, which then can also further reduce the stomach acid, leading to chronic heartburn and GERD. So this is related to SIBO just in the sense that having an awareness of the importance of stomach acid and understanding how some medications used to treat heartburn can actually make the problem worse. But there are things that you can do to help reduce this problem. Okay, so the other thing is altered bile flow and enzyme production. So we need the enzymes we need the stomach acid to activate these enzymes, okay? So when the food goes into your stomach and then as it's entering your small intestine, there is a release of enzymes mostly from your pancreas. There's some also already in the stomach. But when you don't have that acid, it doesn't activate those enzymes, so they don't work as well. And so if they're not working as well, they're not breaking down your food, such as your carbohydrates as well. And so that is giving something for those bacteria to eat and digest and cause the production of those gases, the methane and the hydrogen gases that cause the bloat. Bile, in addition, has an antibacterial effect, and it reduces the risk of that overgrowth simply by the fact that it helps to kill and keep those populations down that might be coming from your mouth. So those two forms of the digestive system really need to be working properly in order to prevent the development of overgrowth of bacteria in your small intestine. Okay, so chronic stress, I mentioned this when I was talking about stomach acid, but not only does it reduce stomach acid and also those enzymes in the bile that we just talked about that are so important, it also can weaken the immune system. And like I was mentioning, the immune system is almost 90% of it is in the digestive tract. And so because we're getting all of these things from the outside world through our digestive systems. And so when you have chronic stress, your immune system is not able to handle those invaders as well. And so you're more likely to have overgrowth and other pathogens. Also, it can affect the motility of the gut. So that migrating motor complex is definitely affected by stress. When you're having stress chronically that is not reduced through stress management strategies, it can build up and cause a lot of problems with your digestion. I just want to briefly mention there can also be some functional abnormalities that can contribute to the development of SIBO. These would be things that would interrupt the normal flow of food through your digestive tract. So abdominal adhesions that can result from any kind of surgeries or even injuries, obstructions of the bowel, again, from adhesions, possibly, or other forms. And then also diverticuli. So, you may have heard of diverticulosis. That is the inflammation of these diverticuli. But when you have a low fiber diet, you can sometimes create these pocketings in the intestinal, along the intestinal tract, and things can get trapped there. And it can also just lead to more overgrowth within these pockets. The ileocecal valve, again, that's the valve between the colon and the small intestine. If that becomes removed or impaired in some way, that's going to affect the ability to keep those bacteria in the colon. And then if you have other things like masses or any problems that's obstructing the bowel, as well as gallstones or removal of the gallbladder, can affect the production of, or the flow of bile. I just threw this in here because I thought it was kind of cute, but these are the school children and their idea of the digestive tract, and I just threw it in there to kind of break it up. A little humor. Another thing that can contribute to small intestinal bacterial overgrowth is food poisoning. So if you get sick, some kind of virus or bacteria in your intestinal tract can attack, that will basically, those pathogens can attack the cells and cause a problem with the migrating motor complex. So once those toxins from the infection are attacked, they are then going to affect the ability of the food to properly move through the digestive tract. And when the food is not moving along, again, that can affect, quite a significant increase in the chance of having infections from overgrowth after some other kind of food poisoning event or gastritis. Other things that can affect the migrating motor complex are hypothyroidism. The thyroid is responsible for many things in the body. Thyroid hormone has a receptor in every cell of the body. If it's slow, the movement of the digestive tract can be lower, and that can affect the migrating motor complex. Also, certain medications slow down the digestive tract, such as opioids. Proton pump inhibitors, those are those antacid medications that suppress stomach acid again, which can affect the ability of the enzymes to work properly, as well as the antibacterial effect of the stomach acid. So inflammatory bowel disease also affects the cells of the migrating motor complex. So things like inflammatory bowel disease like Crohn's and colitis. Diabetes, again, just injuring the cells, affecting the migrating motor complex. Celiac disease is another inflammatory bowel disease, gastroenteritis, and C. difficile is a pathogen that is very can be very affect the digestive system a lot, and one of the ways that it does that is affecting that motor complex. Even Lyme disease can affect that motor complex, and if you have a history of an eating disorder, it can manifest later in life with a dysfunction of that migrating motor complex. Other things that can disrupt the microbiome, just in more general terms in the colon, is these are things that just develop. The microbiome develops at birth as an infant passes through the vaginal canal, and if that doesn't happen, they don't get the same natural development of their microbiome. Not that they still can't later in life, it's just not the same process, and so that can affect the microbiome. Also, bottle feeding instead of breast milk. There are many nutrients and oligosaccharides that are found in breast milk that are in there just for the purpose of feeding the bacteria and helping develop a good, healthy microbiome. Heavy antibiotic use, of course, that antibiotics are not selective, and sometimes they will wipe out the good bacteria in the microbiome as well as whatever pathogen you're trying to eliminate. And then again, over there is the antacids affecting the microbiome as well. All right, so in terms of diagnosis for SIBO, the breath test is a non-invasive test that I typically use in my office. There is another test where you actually aspirate the fluid of the small intestine, but it's much more invasive. And the testing result where you breathe in a drink mixture that has some sugar and water, and you wait a certain period of time, and then you inhale or you exhale into this collecting bag. And if there is a presence of hydrogen or methane gas in a certain pattern, then it's indicative and pretty clear that you're producing these gases, the bacteria are present in your small intestine, and that you would have SIBO. So that is the diagnostic test that I use, and I actually use it as a kit where you take it home and do it there and send in the sample in through the mail, and so it's pretty easy to do. All right, and just a couple more things in terms of the complications of SIBO, because it's how it can affect your overall health. So it can lead to malnutrition, partly due just because of the way that the bacteria are actually getting some of your food before you do. And so, and it's affecting, it is also affecting our ability to absorb fat and carbohydrates. So that can be problematic. In addition, it can cause some vitamin deficiencies, especially the fat-soluble vitamins like vitamin A, D, E, and K. And then also vitamin B12, which is actually made or synthesized in the small intestine by the bacteria there, and it's essential for vitamin B12 is very important for the nervous system and also energy production for the blood cells and DNA. So we don't have that, we can have fatigue, we can have more prone to anxiety and depression, things of that nature. And I'm going to go ahead and skip down to the last one here because I just mentioned anxiety and depression, but that I definitely would say is a very big one for when people have SIBO. They're often also having symptoms of anxiety and depression. And because of the nutritional imbalances, but also some of the hormonal imbalances that can come from that, from the SIBO. And when you have any imbalance in the microbiome, it's affecting the immune system, it's causing inflammation. There's a lot of inflammation that goes on even in the brain. Recent research has shown that a lot of these conditions like anxiety, depression actually have a pretty significant influence by just inflammation on the brain. And so addressing where is that inflammation coming from can help to relieve the anxiety and the depression, as well as understanding what other factors are contributing to it, like nutritional deficiencies. And in terms of hormonal imbalances, so The microbiome is responsible for many things, but one of the things is making sure that the hormones such as estrogen are excreted properly. And there's some different chemical processes that have to happen that the bacteria are involved with. And if they don't occur, then you can have a recycling of those estrogens, leading to conditions like estrogen dominance, which can lead to irregular heavy periods and other issues. So it's really important to address gut health and things like SIBO when addressing things like anxiety and depression. The other two here are just more related to calcium metabolism. So if you're not absorbing your calcium over time, you can lead to osteoporosis, but it can also over time lead to kidney stones. Oh, one other thing, I didn't write it here, but I did mean to say, I mentioned like the inflammation in the gut caused by things like overgrowth can also cause that inflammation, can cause the toxins from the bacteria to leak into the immune system and can affect the brain there, as well as can cause some cross-reactivity in the immune system and confuse the immune system, leading it to attack the body itself, leading to autoimmune conditions like Hashimoto's or rheumatoid arthritis, things like that. So just highlighting that to understand kind of how important it is for gut health to be really balanced and in check, to kind of make sure it's really the core of health. All right, in terms of treatment for SIBO, conventional treatment typically is antibiotics in conventional medical treatment, whereas which can be effective in killing off the bacteria overgrowth. The problem is that it doesn't necessarily address the underlying cause of how that bacteria became overgrown in treating those things. So if you see over here on the naturopathic side, some of the things that we're using, in addition to some antimicrobials or natural antibiotics, which in this case I really like to use spore-based bacillus probiotics. They have specifically actually target bacteria and have been studied specifically for SIBO, and to be comparable to antibiotics in terms of their ability to kill the bacteria. And they don't necessarily disrupt the good bacteria, which is really kind of the strength of that. Also using immunoglobulins, so actually giving your body some immunoglobulins to help bind toxins and bacteria to get them out of the body. So a lot of times if you have overgrowth and you kill them with something like a strong antibiotic, you can experience die-off symptoms where all of the, as your body processes all of that, those bacteria as they die, can actually make you feel quite a bit worse. So binding them up and getting them out of the body can reduce those symptoms. Also using pro-motility herbs to kind of help supporting the migrating motor complex. The two great ones there are ginger and artichoke. Artichoke is really wonderful too because it really helps to improve bile flow, production and bile flow from the gallbladder and the liver. And so again, just as a reminder, bile is really important for its antibacterial properties as well. So using those two herbs in combination really help to address that. And then using this special diet called the FODMAP diet to help while it's not a permanent diet, but while you're being treated, when you're being treated for, when you're doing the treatment for SIBO, having a temporary dietary change is basically avoiding certain foods that have these sugars that feed the bacteria. And that basically just helps to, if you think about it, you're just starving them. So you're not giving them as much of these other they're specific in the kind of bacteria that they like. So see, I had a question over here. How do you use immunoglobulins for treatment? And wondering if it's transfusions. So no, it's actually a capsule that you take orally. And it's in combination, the product I use is in combination with the spore-based bacillus probiotic. So you take them together. Let me know if that didn't answer your question. But yeah, it's just something you take orally. Okay, yeah, you're welcome, Lindsay, no problem. So, okay, and then the other thing I really want to look at is food sensitivity testing. So that's a blood test to look and see, is your body reacting to any other foods besides the one in the FODMAP diet? For example, gluten and dairy are the two ones that I most commonly see as sensitivities. It might not be permanently so, but if they're causing some more inflammation in the body, you definitely want to take them out of your diet while you're healing your gut and getting things back in balance. Also, because of the nutritional deficiencies that often go along with SIBO, I want to make sure you're getting them in supplements. So vitamin B, A, K, E, calcium, and iron as needed. Usually it just means taking a good multi while you're going through this treatment. And really, I recommend multis all the time as preventative measures as well. And then in addition, you want to make sure you're doing something proactive for stress management because that can really be a trigger for this all starting. If your digestive system is not properly functioning, that is, with the acid production, the bile production, the enzyme production, the motility complex moving everything along as it should. And when you're in high stress, you're not in that parasympathetic mode, and you're really just not allowing your body to do what it's designed to do as well as it could. So doing things like regular routines around breathing exercises, meditation. I have done a whole webinar on stress management strategies, but one of my favorite ones is really just taking time to do some deep breaths a few times a day, even when you're feeling not stressed. And that can really help to keep that stress from becoming chronic. And also mindful eating is all very important. So a lot of people eat on the run, distracted, eat way too fast. And when you sit down, intentionally take a couple of breaths before you start eating and really allow yourself to enjoy your food, you're going to improve your digestion and help prevent things from coming back or developing in the first place. So overall, addressing the root cause. So I did go through a lot of different things at the beginning of this presentation, maybe too much detail, I don't know, but in terms of what can cause SIBO, and we want to address any of those problems that we might discover in order to make sure we are treating the whole body and doing everything we can to keep it in balance. So again, summary for prevention: managing stress, finding and treating the underlying cause, doing things like either taking digestive enzymes with some bile or taking botanical bitters to really optimize stomach acid production of those stomach acid, bile, and enzyme production. And then eating probiotic foods or taking probiotics, fermented foods like kimchi, sauerkraut, miso, different foods that all have natural live cultures, and eating a little bit of that every day can really help to keep those probiotics in the microbiome, which help keep the overgrowth of the ones that you don't want to grow. All right, so I'm happy to take any questions if you have any more, but that wraps up for the presentation. But finally, I just want to let you know that now you have an opportunity. Once this presentation ends, you'll see a green button that you can push, and it will give you an opportunity to sign up for a call with Whole Health Wellness Center team member to discuss with you kind of your health concerns. Maybe some of the things that I talked about in this presentation really made you think that you'd like to do some further testing to see if maybe you do have SIBO, or if not, if there's something else that could be contributing to whatever symptoms you're having. So yeah, once this call is over, you'll have a chance to make that call or make an appointment for that call. And if you decide if after your call you decide it's a great fit for you, you want to book an appointment, they can help you with that as well. And in your first consultation, just for your information, we can do a virtual or in person right now, so whatever your preference is. I tend to like to do the first visit in person if it's a possibility, but for whatever reason you do virtually, it's absolutely an option. We can do that as well. Here we are credentialed with insurance companies. You can see Aetna, Cigna, and Blue Cross Blue Shield are the major ones that we are with. And then the first visit is an hour, so we want to have plenty of time for me to take a comprehensive history and be able to understand everything that might be contributing to whatever your health concerns are. And then as a thank you for joining us tonight for this webinar, you also get a in-body body composition analysis free of charge. That is basically a way to measure your body composition, so your muscle content as well as fat, and seeing where there might be any imbalances, and it gives us a better assessment than just a number on a scale of how to improve your health. So okay, yes, so I just want to encourage you, if anything that I said tonight made you think that it's something you might have going on, please don't hesitate to join us and give us a call. All right, thank you so much for joining us, and I hope to see you soon. Take care. Bye.